The new school year is in session. Many parents are still struggling to find their children's ADHD medication. Adderall and other stimulants have been in short supply for nearly a year now. The Fox Medical Team's Beth Galvin is joining us to talk about the shortage.
These stimulants can be really helpful for people who are living with ADHD, but they're incredibly hard to find right now, especially the generic forms of the medication. And this shortage could go on for another 3 or 4 months. If you've had a hard time filling your Adderall prescription, you're not alone. Earlier this year, the National Community Pharmacists Association reported 97% of independent pharmacy owners were experiencing shortages of Adderall. And Dr. Subrat Bhargave of the Center for Family Psychiatry in Tyrone says many of his patients with ADHD are feeling the shortage too.
Well, there's at least 2 big factors that contribute to the impact of the shortage. And really, it comes down to supply and demand.
The FDA first reported a shortage of stimulant medications last fall after one drug manufacturer experienced production delays and others produced only about 70% of their allotted DEA quotas, failing, the FDA says, to make and ship as many as 1 billion doses of the stimulant medication. And this came as demand for ADHD drugs surged during the pandemic as more people sought help for attention disorders and psychiatrists began treating patients and prescribing medication virtually.
The diagnosis has gone up. In many cases, it's because you finally have people who are able to access good mental health professionals. But in some cases, there was also a bit of a misdiagnosis as well. So it really is a perfect storm between demands going up and supply going down.
The FDA says while some shortages have already been resolved, other stimulants may be in short supply until December. And Dr. Bhargave says in the meantime, he's working with patients to try to find solutions.
This really has shown me to be their best medication among the things we've tried. Then we have to get a little creative sometimes with combining different doses that might be more available to get the same desired eventual dose of that medication.
But Bhargave says in most cases, they've actually been able to find a treatment plan for his patients that may yield even better results than stimulants.
But it does mean talking through what they've tried before, what didn't work before, what are some side effects they might be particularly worried about that we might be able to work around. Again, especially now that we've got even better options.
Another challenge, these stimulants are controlled substances, so you can only get a 30-day supply filled at one time, and that means month to month, people are having to go out and find the medication to refill their prescription. For your Fox Medical Team, I'm Beth Galvin.